Why do thousands of seniors suffer strokes in their own bathrooms every year? And what if something as simple as adjusting your shower temperature or timing could be the difference between a normal morning and a life-threatening medical emergency? What I'm about to share might shock you because these aren't rare or extreme behaviors. These are everyday shower habits that millions of people over 60 practice without realizing they're dramatically increasing their stroke risk, in some cases by more than 40%. 5 specific habits, each one backed by rigorous medical research, each one completely preventable once you understand what's actually happening inside your body when you step into that shower. Let me start with habit number 5. And this one surprises almost everyone I tell about it. Showering immediately after eating. Seems harmless, right? You finish breakfast, feel refreshed and ready to start your day, so you hop in the shower. But here's what's actually happening inside your body during those 15 minutes under the water. When you eat, your digestive system demands a massive increase in blood flow. Studies show that about 30% of your circulating blood volume gets redirected to your intestines to help digest food and absorb nutrients. Meanwhile, hot shower water causes your skin blood vessels to dilate, pulling blood toward your body's surface to regulate temperature. Your cardiovascular system is now facing 2 competing demands for blood flow, and something has to give. What gives is blood flow to your brain. Tokyo Medical University conducted an 18-month study following 2,400 seniors and found that showering within 1 hour of eating increased episodes of dizziness and fainting by 21%. But here's the truly alarming finding. When they analyzed stroke cases specifically, they discovered that 44% of post-shower strokes in seniors occurred within 1 hour of eating a meal. 44%. That's nearly half. The European Heart Journal published research explaining the mechanism. When your brain is temporarily deprived of optimal blood flow due to this competition between digestion and temperature regulation, you're at increased risk for what doctors call a vasovagal response. Your blood pressure drops suddenly. Your heart rate slows. You feel dizzy, lightheaded, and in the worst cases, you lose consciousness. In a slippery shower with hard surfaces everywhere, a vasovagal episode can be fatal even if it doesn't directly cause a stroke. The fall itself can kill you. The solution is straightforward. Wait at least 30 to 60 minutes after eating before showering. Give your digestive system time to complete the heaviest phase of blood flow demand. This simple timing change could prevent thousands of bathroom strokes and falls every year. Habit number 4 is taking extremely cold showers, and I need to explain why this is particularly dangerous for people over 60. Cold water exposure causes immediate and dramatic vasoconstriction. That's the narrowing of your blood vessels, and it happens within seconds of cold water hitting your skin. When blood vessels constrict rapidly, your blood pressure spikes sharply because the same volume of blood is now being forced through narrower pathways. Research published in Circulation studied adults over 55 exposed to cold water and found that systolic blood pressure, that's the top number in your reading, increased by an average of 34 points within just 2 minutes of cold exposure. 34 points. If you're starting with a baseline pressure of 130/80, which is already borderline high, cold water can push you to 164/80 or higher within minutes. At those pressures, weakened blood vessels in your brain are at serious risk of rupture, causing what's called a hemorrhagic stroke. The International Journal of Biometeorology published a study from Japan tracking stroke incidents across seasons and found a 37% increase in stroke cases during winter months, with cold water exposure being identified as a significant contributing factor. Your body at 60, 70, or 80 doesn't respond to temperature stress the same way it did at 30. Your blood vessels are less elastic. Your cardiovascular system has less reserve capacity. What might be an invigorating cold shower for a young person becomes a potentially lethal blood pressure spike for an older adult, especially one with any degree of hypertension or cardiovascular disease. If you enjoy cooler showers, and I understand the appeal, make the temperature transition gradual. Start warm and slowly, over several minutes, reduce the temperature to comfortably cool, not cold. Never shock your system with sudden cold water. That sudden vasoconstriction is what creates the danger. Habit number 3 involves something many people find embarrassing to discuss, but needs to be addressed directly because lives depend on it. Straining during bowel movements while showering. This happens more often than you might think. People feel the urge while in the shower, and rather than getting out, drying off, and using the toilet properly, they try to manage it right there. The straining involved creates what medical professionals call a Valsalva maneuver. You're bearing down, holding your breath, and creating enormous pressure inside your chest and abdomen. The New England Journal of Medicine published research showing that the Valsalva maneuver during straining can spike blood pressure by 40 to 60 points almost instantly. That's not a gradual increase. That's a sudden, massive surge. Simultaneously, the increased pressure in your chest reduces blood return to your heart, which then reduces blood flow to your brain. So you're getting this dangerous combination of spiking blood pressure followed immediately by reduced cerebral blood flow. Your brain's blood vessels are experiencing extreme fluctuations in pressure and flow, which is exactly the condition that triggers strokes. The University of California, San Diego studied this phenomenon and found that the hot, humid environment of a shower amplifies the cardiovascular response to straining by approximately 23% compared to straining in a normal bathroom environment. The heat makes your blood vessels more reactive and less stable. Japanese researchers publishing in the Journal of Stroke and Cerebrovascular Diseases analyzed stroke cases and found that nearly 19% of strokes in seniors occurred during bathroom activities involving straining. 19%. The other serious risk is cardiac arrhythmia. When you strain forcefully, especially in a hot environment, your heart rhythm can become irregular. Atrial fibrillation, a common arrhythmia in older adults, dramatically increases stroke risk because irregular heartbeats allow blood to pool and form clots. If one of those clots breaks loose and travels to your brain, you have an ischemic stroke. Never, and I mean never, attempt to have a bowel movement while showering, especially if it requires any straining. If you feel the urge, get out, dry off enough to be safe, and use the toilet properly. If constipation is an ongoing issue, address it with your doctor. Dietary fiber, adequate hydration, and when necessary, appropriate medications can prevent the need to strain, which protects you not just in the shower, but throughout your day. Habit number 2 is standing up too quickly after sitting in the shower, and this one has caused more falls and strokes than most people realize. Many seniors use shower seats or benches, which is actually an excellent safety modification. The problem occurs when you stand up abruptly after sitting for several minutes in hot water. What happens is called orthostatic hypotension, a sudden drop in blood pressure when you change positions from sitting or lying to standing. Gravity pulls blood down into your legs when you stand. Normally, your body compensates immediately through cardiovascular reflexes that constrict blood vessels and increase heart rate to maintain blood pressure and brain blood flow. But these reflexes slow down significantly as we age. They're also impaired by heat exposure, because hot water has already caused widespread vasodilation throughout your body. So when you stand up quickly after sitting in a hot shower, your blood pressure can drop precipitously before your body can compensate. The Journal of Clinical Hypertension published research showing that orthostatic hypotension in seniors showering can cause systolic blood pressure drops of 42 points or more within 30 seconds of standing. 42 points. If your sitting pressure was 120/70, standing could temporarily drop you to 78/50 or lower. At those pressures, your brain isn't getting adequate blood flow. You feel dizzy, lightheaded, your vision may gray out, and you can easily lose consciousness. Research published in Stroke, the Journal of the American Heart Association, found that 17% of transient ischemic attack patients, those are mini-strokes, reported a history of standing quickly after hot showers or baths before their neurological symptoms began. The German Center for Cardiovascular Research tracked seniors with a history of orthostatic hypotension and found their stroke risk increased substantially during and immediately after showering, with rapid position changes identified as a primary trigger. The solution requires conscious attention to how you move. If you use a shower seat, which again I recommend, stand up slowly and deliberately. Take at least 10 to 15 seconds to transition from sitting to standing. Pause halfway up if needed. Hold on to grab bars or the wall for stability. Let your cardiovascular system adjust gradually rather than forcing it to respond to a sudden change. This simple modification in how you stand up could prevent a fall that breaks your hip or a stroke that changes your life forever. Now we reach habit number 1, the most dangerous shower habit for seniors, and this one increases stroke risk by a staggering 43%, according to research. Taking very hot showers for extended periods. The American Heart Association conducted a 5-year study following 3,200 seniors and found that those who regularly showered at temperatures above 105 degrees Fahrenheit for more than 15 minutes had a 43% higher stroke rate compared to those who took shorter, moderately warm showers. The data showed stroke risk increased approximately 8% for every additional 5 minutes spent in water above 105 degrees. Let me explain exactly what happens inside your body during a very hot, prolonged shower. The heat causes extreme vasodilation. Your blood vessels dilate widely to release heat and regulate your body temperature. This widespread dilation causes your blood pressure to drop, sometimes by 30 to 40 points. To compensate, your heart rate increases dramatically, often by 30 to 40 beats per minute. So your heart is working much harder, pumping faster to maintain adequate blood flow despite the lowered blood pressure from vasodilation. For someone in their 60s, 70s, or 80s, especially someone with any degree of heart disease, this represents enormous cardiovascular stress. Your heart is being forced to work at near exercise levels while you're just standing still in the shower. The European Society of Cardiology published research showing that this combination of low blood pressure and elevated heart rate creates the perfect conditions for cardiac arrhythmias, which, as I mentioned earlier, dramatically increase stroke risk through clot formation. But there's another mechanism at work that's equally dangerous. Prolonged heat exposure causes dehydration. You're sweating even though you don't feel it because you're wet from the shower. As you become dehydrated, your blood becomes more viscous, thicker, and flows less smoothly. Thicker blood is more prone to clotting. If a clot forms and travels to your brain, you have an ischemic stroke, the most common type, accounting for about 87% of all strokes. The American Journal of Emergency Medicine documented numerous cases of seniors found unconscious in showers, and Johns Hopkins research found that many bathroom strokes occur during or immediately after hot showers lasting 15 minutes or longer. The heat stress, the cardiovascular demand, the dehydration, and the blood pressure fluctuations all combine to create what researchers call a perfect storm of stroke risk factors. The solution requires discipline, but it's not complicated. First, lower your water temperature. Aim for 95 to 100 degrees Fahrenheit. That's pleasantly warm, but not hot enough to cause extreme vasodilation. You can verify temperature with an inexpensive shower thermometer if you're not sure. Second, limit your shower duration to 10 minutes or less. Set a timer if necessary. Most people can accomplish everything they need to in the shower within 10 minutes. Anything beyond that is exposing yourself to unnecessary risk. I know these recommendations might feel restrictive, especially if you've enjoyed long, hot showers your entire life. But the research is unambiguous. After 60, your cardiovascular system doesn't handle heat stress the same way it used to. Your body's ability to regulate temperature, maintain blood pressure, and compensate for environmental stresses all decline with age. Accepting these changes and adapting your habits accordingly isn't weakness. It's wisdom. It's choosing continued health and independence over temporary comfort. Let me emphasize something crucial. You don't need to have had a previous stroke or even diagnosed cardiovascular disease to be at risk from these shower habits. The seniors in these studies were regular people, many without known heart problems, who suffered strokes triggered by these seemingly innocent daily habits. The physiological mechanisms I've described, the blood pressure fluctuations, the vasoconstriction and vasodilation, the cardiovascular stress, all of these happen to everyone exposed to these conditions. Having underlying heart disease or hypertension increases your risk substantially, but even healthy seniors are vulnerable. So here's what I need you to do immediately. Evaluate your current shower routine honestly against these 5 habits. Are you showering right after breakfast? Stop. Wait at least an hour. Are you taking cold showers? Switch to warm. Are you ever straining during bowel movements in the shower? Never again. Get out and use the toilet properly. Do you stand up quickly from a shower seat? Start moving slowly and deliberately. Are your showers hot and long? Lower the temperature to 95 to 100 degrees and set a 10-minute timer. These changes require zero equipment, zero cost, and minimal effort. Just awareness and conscious choice. Yet they could reduce your stroke risk by more than 40% based on the cumulative research. Think about what that means. Nearly half of your modifiable stroke risk from showering eliminated through simple behavioral changes. Talk to your doctor about these risks, especially if you have hypertension, heart disease, diabetes, or previous stroke or TIA history. Your physician may have additional specific recommendations based on your individual health profile. But regardless of your health status, these 5 habits represent dangers for every senior. Share this information with people you care about: your spouse, your aging parents, your friends, your neighbors. Stroke is the 5th leading cause of death and a leading cause of serious long-term disability in the United States. Many of these strokes are preventable. Many happen in bathrooms during routine activities that could be modified to eliminate risk. Your morning shower should be refreshing and safe, not a daily game of cardiovascular Russian roulette. Make these changes today. Lower your temperature. Shorten your time. Wait after meals. Stand slowly. Never strain. 5 simple adjustments that could save your life or preserve your quality of life by preventing a disabling stroke. Your brain, your heart, and your future self will thank you for the small sacrifices you make now to protect them. Don't wait until you experience a warning sign, or worse, a full stroke. Prevention is infinitely better than treatment. Take control of these modifiable risks today. The shower is a place for cleaning and refreshment, not a place for life-threatening cardiovascular stress. Make it safe. Make these changes now.